Okay, well, welcome, Pahrump. I'm here tonight. I'm Dr. Michael Reiner, and I'm here to do the weekly Independent Doctors of Pahrump TV show. At any rate, tonight I wanted to do a talk about chronic obstructive pulmonary disease, otherwise known as COPD, and some people talk about that as emphysema. Those terms can be used interchangeably, and we're going to, I've decided to put this in kind of a presentation, almost a PowerPoint, to make it a little bit easier just so we can stay on track. And also, if you have any questions, I believe we might have a dial-in. If not, then they might put that up later. So let's go ahead and bring up the presentation, and let's see here. That should go, okay. So COPD is a horrible disease. It affects quite a few patients, and so we'll go into what is COPD. It is a term referring to multiple lung diseases, chronic bronchitis, emphysema, that are characterized by outflow obstruction. And these conditions can exist, like I say, with chronic bronchitis or without chronic bronchitis. COPD is what they call a small airway disease, while emphysema is basically an alveolar disease. And alveolar is the end function, or the small little grape-like, and I'll have a diagram to show that to you later, what the alveolar disease is like, but the chronic obstructive pulmonary disease is mainly focused into the small airway, and that is imagine that you had a little bitty straw, and at the end of that straw you had a small balloon. The balloon would be the alveolar part of the lung, while the straw is the small airway. And so that's where mainly this disease takes place. Let's move on to the next slide. The symptoms of COPD can be cough, obviously, a chronic cough. Dyspnea is a term used for shortness of breath. Wheezing is a symptom of small airway obstruction. It is not large airway obstruction. Some people will get a chronic bronchitis and they'll hear this mucus kind of stridor in their lung. That is not wheezing. That is a large airway issue. A small airway is, usually you don't hear it. Usually it's something, and coughing is caused by chronic wheezing. Patients can have chest pain. Hemoptysis is a term for coughing up blood. That can usually come with chronic bronchitis. It can come with cancer. It can come with a lot of other irritations. And really, in its basic form, chronic obstructive pulmonary disease is a inflammatory type of disease. There's a lot of chronic manifestations associated with that. In addition, we can have cyanosis, which is a term used for a bluing color of our skin. The other thing that you will see on your slide or on the TV is a term called GERD. GERD is a term for gastric esophageal reflux disease, and it's recently been linked to emphysema, and it also is a cause that I see quite often for a chronic cough. And what that is acid is constantly being, when you overweight, when you have, and as we weaken our diaphragm, and that's a topic for another discussion. It's just GERD, but when you weaken that diaphragm and you have that acid reflux, acid refluxing up out of the stomach can be a chronic irritant to the lung. And that can cause a chronic cough, and it could be a source for emphysema. So those people who may not smoke, who maybe have had no other issues, that may be something to be considered as a cause, as well as it's something to be treated if you do have acid reflux, because it's long-term complications. Not only could it mimic a heart attack, doesn't mean you'll have a heart attack, but it can cause lung problems from a chronic cough and chronic bronchitis. And edema, which is a swelling of your body, will come as a late case in chronic obstructive pulmonary disease. It is what we're going to see as the right side of the heart fails due to poor circulation to the left, from the right side to the left side. It's a term called cor pulmonale. It's an end stage of chronic obstructive pulmonary disease, and certainly a very horrible thing to have happen to you as a result of that. These are some statistics about COPD. And we can bring those up. It's the 4th leading cause of death in the United States, and about 13.5 million adults have reported by either diagnosis or by a physician of having COPD. 29 million adults have evidence of impaired lung function, and you can see 10 million patient visits per year into a doctor's office for COPD and other related conditions, 2 million hospital emergency room visits, 726,000 hospitalizations per year. And this is old data, but in 2004, COPD cost the nation $37.2 billion. And who knows what that is in today's numbers, but you can only imagine it's got to be at least double that. And it is true, COPD is the #1 cause of debility in the United States. So again, those are just some of the impact COPD has upon the nation. I know that even in Pahrump, as you travel down the road, as you look out there, we're an aging population. As you travel to the casinos, if you travel around, you can get a feel for that COPD. I mean, one of the things I know as a physician and what I see is the population that I'm dealing with today. We're coming from the 40s and the 50s and into the 60s, and at that time, I mean, there was something wrong with you if you didn't have a cigarette in your mouth. I mean, everybody smoked at that time, and that is an unfortunate problem, because we just see so many people suffering from the end stages of those 20 and the 40-year pack-year histories. And that's why you see so many issues today. What we're going to do is talk a little bit about the cause and effect of COPD. The first slide shows that we have persistent inflammation from infections and noxious substances and chemicals, like obviously cigarette smoke. And the free radical formation. Free radical formation is that end-stage oxygen, and if you don't know anything about free radicals, they're free electrons, and free electrons irritate tissue, they cause scar tissue, and that is the scarring process in that small airway. So, and I have further slides that demonstrate how COPD actually does damage the airway and cause the obstruction of that particular disease.
Are you able to, can you clear it out? Are you able to clear it out?
Or is it going to consistently stay there? I mean, is there a way that you can clear up these symptoms?
Yeah, I mean, as we talk about how smoking causes COPD, and we'll talk about that a little bit later, but what happens once damage is done to the lung, that damage cannot be repaired. What you can do is lessen the effect and slow down the damage. And I'll have a slide later that shows you that if you smoked for 10 years, you decline your lung function and it's accelerating. And then when you stop smoking, it basically picks up the same rate of loss as if you were never smoking, but you can never regain the lung function that you've lost as a result of smoking in COPD. I have a slide later that shows that. And but once you do stop smoking, you do actually stop the damage and the further progression of disease. And like I said, so that slide will, I'll show it. It's really plainly evident how that occurs. Okay, we're going to go to break, and we'll be back, and we'll pick up this discussion when I come back. Thank you for tuning in to the Independent Doctors of Pahrump.